happening here. What it is ain't exactly clear. There's a man with a gun over there telling me I got to beware. I think it's time we stop. Children, what's that sound? Everybody look what's going down.
Hi, and welcome to episode 47 of Occupy TV. I'm Joe, and I'm with Renae Myers today, who's with Healthcare for All. Is that the actual title of the group?
The coalition is Healthcare for All Oregon. Yes, it's based out of Portland.
Healthcare for All Oregon, based out of Portland. And you're basically advocating a single-payer system.
That's right. And the name of the coalition used to be Single Payer Oregon. After a failed attempt, it's time for a reboot and re-energizing. And so now we are Healthcare for All Oregon.
Okay.
And we have local chapters, like we have a Healthcare for All Oregon Eugene chapter. And then there are other groups that are really similar, like Mid-Valley Healthcare Advocates in Corvallis and Benton County.
Okay. And I guess people that show up at your meeting are the Mad as Hell doctors. I guess they're out of Corvallis and made a documentary and toured all over the country to argue that we need to fix the healthcare system.
That's right. The Mad as Hell Doctors are an activist group of an organization called PNHP, which is a more serious overhead.
So what does that stand for?
Physicians for a National Health Plan, actually. And a majority of physicians in the United States do favor a single-payer program. And so Physicians for a National Health Plan has local chapters. It's a national group, and we've actually just one of our volunteers with Healthcare for All Oregon is Mark Bronner, and he's a physician in Eugene, and he's actually just started a PNHP for Lane County. So that's really exciting too. So
start getting some more doctors involved in talking about this here. Yeah, I had a few years back. I had an experience with. I dated a woman who. Her mother and father were both anesthesiologists, and they were near retirement and just couldn't wait to get out of the business at that point because the corporate suits had kind of taken it over, and they were pushing them real hard to do more productivity, more operations. I mean, these are anesthesiologists, and it's like you got to do more operations, you got to spend less time with your patients, you got to all this and that.
Well, sure.
And they wanted out. They were in their late 60s and had been at it since their late 20s when they went through medical school, and just couldn't wait to get out of it.
I think that's a really common sentiment. I mean, people don't go into medicine because they're business people. I mean, I suppose some do, but I think in large part people become doctors because they want to help people and they want to heal people and they want to study and practice the art of medicine, not sell product. And but that's the system that they're entered into in the United States. Yeah,
and I had a younger doctor that I knew down in Southern California when I was living there, who wound up in an HMO and got out of medical school and was in there, and just the productivity demands on him, it's like less than 5 minutes per patient, get him in, get him out, and just keep, and he just drove him nuts. And I mean, I've actually come across people who've left the field because that's what their experience is.
Because they aren't healing people.
They're not healing people, they're making money.
Maybe they would have been more satisfied and fulfilled in an organization like Whitebird or Occupy Medical.
Or find something else. He actually joined the Peace Corps.
Oh, nice.
Went over and took, did stuff and seemed to be pretty happy with
Was
that.
he able to practice medicine within the Peace Corps?
Oh, yeah. Oh,
good.
Yeah. They were overjoyed to get him. Let's put it that way.
It was spectacular. There's always Doctors Without Borders too.
Yeah. But yeah, we have, I guess, what many people consider to be a breakdown of the healthcare system in the United States, where it's costing us too much and the outcomes are not great. So
that's right.
I guess there were some numbers that were done. The 2000 World Health Report put us 37th?
37th for outcomes, or for because there's many, and I'm not most familiar with all of them, but I've also seen us ranked in terms of fairness. When they assess the fairness of a healthcare system, the United States gets put way down on the list.
Way down, yeah.
outcomes such as infant mortality, healthy life expectancy, we don't do so great. But the one thing that we are number one at is spending.
Paying.
Yes, we are the biggest payer. We spend more than any country in the world on health care. And
It's not by a little bit. It's almost a factor of 2.
it's by a lot. Yes,
Yeah.
we pay, yeah, you're right, almost twice.
Almost twice as
the
much
next-
as the next closest country.
That's
And
right.
they're getting much better outcomes overall.
That's right. And that next biggest spender, I believe, is Switzerland.
Yeah.
And they do get better outcomes. It's interesting when you look at the graph that charts spending and outcomes. You know, because other countries will spend a fair amount on healthcare, but it's usually associated with improved outcomes. You know,
Yeah.
there's usually something that you get for it, and the United States, in all cases, is the single outlier on that.
Yep.
We just spend more. We don't have better outcomes at all.
Yeah, the 2000 report was very controversial, and it put us at number 37. But then in 2007, they also, that was when the World Health Organization listed how much we spend. And at that point, it was 15.4% of our GNP. And the next closest, I believe, was 10.9, and I think it was Switzerland.
Yeah.
But then almost everybody else was down below 10%. And the thing that's interesting is these other countries, the cost, their amount of spending has not been growing the way that it's been growing in the United States. Because this year we're actually up to 19%. So that's almost 1 out of every $5 we're spending on healthcare.
Yeah, not a lot of people realize we spend more on healthcare than we do on defense.
On the military.
Yeah. And that's something I had to check my facts the first time I made that comment, because it was so vehemently rejected, and they were like, nope, nope, we spend more on defense than we spend on anything. And I had to go back and look at it, and I was like, no, we spend more on healthcare than we do on defense. It's absolutely true. But that's all dollars. That's private spending. That's government spending. That's all of it.
Yep.
It is as a portion of our GDP.
So that's the problem that we have, is that we're getting fairly poor outcomes overall across the entire population. But we're spending a huge amount.
We're spending a huge amount, and that's not even the whole picture. I mean, that's bad enough as it is. But,
okay, so what's the rest of the picture?
We don't cover everyone.
Yes.
And once again, we're the only one in the developed world that doesn't cover every citizen and doesn't see healthcare as a human right.
So how did we get there? How did the United States wind up different from, Great Britain and France and Italy and Spain and Switzerland and all these other countries, Canada, that have better outcomes than we have and spend less?
At some point along the way, it became tied to employment.
Yeah.
And once that was in, we just got attached to that, and that was set. And so now people are limited, because when they change their jobs, for example, they can't take their health insurance with them.
Right. So they drop out of one pool and go into another.
That's right.
And yeah, I guess looking around the world, there was a book came out a few years back, must be about 5 years ago. I think it was called The Healing of America. And they talked about 3 different kinds of plans. There was the single payer, let's start with nationalized health care like they have in Great Britain. And that's where all the doctors and nurses and pharmacists work for the government.
They're employees
and
of the
they
state.
get a paycheck from the state. Okay? They spend less on health care, and they have better outcomes than we do. That's
true.
nationalized medicine. Then there's the Canadian system, which is single payer. All of the healthcare providers are private companies. Doctors and nurses are employees of companies. And what happens is that the government collects up taxes and premiums from workers or from companies, and then they disperse it and pay out these firms that provide the health care. And so there is a market. It's the opposite of a monopoly. In a monopoly, you have one producer and lots of consumers. What you have in Canada, is lots of producers and one consumer. It's called a monopsony. Monopsony. And that one works pretty well too, because they have better outcomes than we have, and they pay about half as much. And everybody in the country is covered cradle to grave for everything. And so that's the second system. single payer. The third one is called the Bismarck plan. And that's the case where the insurance companies are involved, but they're extremely heavily regulated. In other words, they are guaranteed a profit. It's about 5% a year, and just for operating the system, they collect the premiums. The healthcare is provided, and they pay the stuff out. So how much they can charge is being heavily controlled. And so that system seems to work pretty well because the Germans pay less than we do for healthcare. Everyone is covered, and they have better outcomes.
That's right.
So then there's what we're doing.
We're unique.
Yeah, we are.
It's only the United States model, but that is the exciting thing, is that we have all of these great models. We're not Germany, we're not even Canada, but we have a lot to choose from, and we have a lot of really great minds who are working on this.
Yeah, because Japan does really well. As I understand correct, I may be wrong on that, is a Bismarck-like model. There's all kinds of countries that are doing this, giving us examples of how to do it. But what we've got right now is failing. So why is it failing?
Well, for exactly that reason, because we treat healthcare as a commodity, as something that can be bought and sold, rather than as a public good. Healthcare is something that we'll all need at some point in our lives. It affects everybody, and right now, the way that it is in the United States, it touches every other issue right now. You can't make advances in labor when you can't get out of talking about healthcare. 50% of foreclosures are due to catastrophic healthcare costs.
Yeah, I had understood that the number was much higher than that, but yeah.
At least 50%.
At least 50. We're going for at least.
Of foreclosures. Perhaps it's 50% of bankruptcies are associated with high healthcare costs, and that's something that you don't have when you offer healthcare as a public good. We need each other to be healthy, and we need each other to be well, to be a productive society.
Yeah, because one bad illness, even if you have, let's say you have an insurance policy. Right now, what is it? 1 out of 5 Americans do not have health insurance?
Yeah.
Somewhere in that.
At least, it's 16 to 25%.
Okay. Depending on where you are and how you count it.
How you count it, yeah.
And then the vast majority of the remainder are underinsured in that the people have never read their policies. And they would discover, if they did, that a lot of stuff would not be fully covered. So if you had a serious illness, between percentage coverage and co-pays, it'd still wipe you out financially.
That's right.
And so that's a serious problem, because a lot of those, both foreclosures and personal bankruptcies, the people had health insurance, and it just didn't cover. It didn't prevent the problem. It
seems to me that whenever an exchange of dollars enters into that side of the equation, it comes out with worse outcomes on the other, and that's easy to see why. Especially with the economy the way that it is, you have somebody who has a problem, or a diabetic perhaps, that has a sore on their foot, and they could go in and they could seek treatment, but they don't, because they have so many other things that they can't even get to, that they can't even afford, and so medical treatment for something that's treatable, simply they don't make it a priority until it's worse, and then they can have an amputation or worse. Stanford University in 2010 found, in their estimate, and then they updated it in 2012 to be 45,000. It was 40,000 and then 45,000 deaths directly associated with lack of access to health care, and that's one of the reasons, is people postponing care for treatable conditions because of money.
Yeah. So, if it's $1 out of $5, that's a problem for most people. If you're just making enough to pay the rent, put food on the table, put the gas in the car so you can go to your job, then healthcare, that's all of a sudden, it's this huge addition that a lot of people can't afford. So, why is healthcare so expensive in the United States?
There are a number of factors that contribute. A lot of people like to point to technology a lot, that we just have the best technology in the world, and that's why it costs so much, because it's the best system in that regard. But
So do you think that's true?
I don't think it's true. I think that the reason that it costs so much, probably the biggest reason that it costs so much, it's not the only reason, but our administrative overhead is 26 to 30% for our country as a whole. And so that means a third of the dollars that you spend are being spent on hiring somebody maybe to find a pre-existing condition so that they can cancel your policy and not have to have a payout, preventing losses basically for the company.
So what does administration cost for other systems in other countries?
It can be as low as 4 to 6%, even lower.
Yeah.
Some systems are able to do it for 2 or 3%.
The Medicare system was doing about 3%.
Yeah, we're able to do it right here in this country for 3%. And I'm not sure what the VA is, but the VA does a fair job themselves.
Is comparable to
It's
Social
like 6,
Security.
yeah, something like that.
So in other words, we've got these for-profit companies that make more money if they deny health care rather than if they provide it.
Exactly.
And so in the process of denying it, they run up the costs. So, and of course there's advertising and marketing and excessive CEO salaries and all that. Other parts in there?
Well, no, those are the biggest part. And something that gets pointed out is that it's research for pharmaceutical companies, you know, and that's so important, and that's why it's so high. But that actually, when you look at the numbers, that's a much smaller percentage as well.
Yeah, and a lot of it's being paid for by the federal government.
That's right.
So a lot of work
that's
being
right.
done
That's
at
not,
universities, and then the companies just take the stuff and capitalize on it.
Research does not account for the 30% overhead.
No, not in the least.
No.
Because other countries are doing the same stuff.
That's true.
But their systems, you know, I mean, there are German pharmaceutical companies and French and British pharmaceutical companies, and they're still making a profit, but their healthcare costs are lower.
When you set your priority at administering healthcare to serve your people instead of your profits, you find that you're able to do a lot more for a lot less.
Yeah. So the United States, I guess, got into this during World War II. Because at the time there were wage and price controls, and what happened at the beginning of World War II was we saw a sudden rise up in prices. In other words, the government is involved in this war, and they're trying to pay for the war, and suddenly all these companies they have to buy stuff from are jacking the prices up. So it didn't take long before the government said, excuse me, we have a war going on, we're going to do some wage and price freezing. And at that point, the companies were looking to attract talent, and so they began to offer health care as a bonus or as part of the compensation package. And it was, you know, a relatively small cost at that point because there were a lot of things we couldn't do very well. So it was only, you know, for an executive package, it might be a couple $1,000s. And so that's where it became linked to employment, because following World War II, we were heavily unionized, and the union said, hey, if healthcare is good for the CEO and the supervisors, it's good for the rank and file workers, so we want it. And I can remember my father was a Teamster, and that was the big issue during the 50s and 60s.
Was probably ecstatic.
Was healthcare for Teamsters. Yeah, it was part of the overall package.
Well, this is right around the time a lot of those companies were probably shooting themselves in the foot, because this is the same period of time that many countries, if they hadn't already, because the first countries to adopt national health plans, it began, you know, in the 1800s. And but if they hadn't already, it was that period of time.
As post World War II.
Yeah, that all the rest of the countries began implementing universal and single payer health plans, and that's actually a barrier to competition for businesses in the United States, because the healthcare costs and providing healthcare to their employees, as the employees and the unions have demanded that they do so, is something that their competitors overseas simply don't have to do.
Yeah, when we're paying 19% of GNP for healthcare in this country, that's a huge, and other countries are paying 10, 11, 9, 8% of GNP. It's a real drag on business to have to compete with that.
It's a dead weight, and it doesn't suit conservative principles and you know, independence and autonomy. You need to be healthy to be at your most productive.
Yeah, but again, the bottom line, the thing that's driving it is the fact that it's a money machine. There are people getting just staggeringly wealthy off of this health system because pharmaceutical companies, hospital, large providers, are making, and certainly the insurance companies are making enormous profits off of this. And so it's driving, in other words, rich people are getting richer faster as a result of this industry, and it's a money machine. And if there's a money machine, people are going to protect it.
Yeah, they're quite defensive over it.
Yeah.
And we've tried. It seems like it, and correct me if I'm wrong about this, but it seems like in every administration there's been an attempt.
Since Nixon?
Yeah, to tackle healthcare reform, and so Obama is getting renowned for his ability to actually pass legislation for healthcare reform, and that is remarkable. That is really fantastic that finally somebody's been able to put this through. But the Affordable Care Act leaves some pretty big holes in what a plan that works for people would do.
Well, it has. So what are the benefits of you hear a lot of derision of Obamacare, but there's some pretty serious benefits in this. What are some of those?
My two favorites are children remaining on their parents' plan until they're 26. Isn't that right? And so that seems to me to be one step closer to a plan that would include everybody, but that's not. It doesn't include everybody. And then there are limitations on insurance companies, and so pre-existing conditions, something that was a huge problem for continuity of coverage for millions of Americans, is outlawed. Right. So those are my two favorite pieces of legislation. So the restrictions that it imposes on the insurance industry are good and important.
So if you ever left a job and you needed health care for anything beforehand, you wouldn't be able to get health care going to the next plan because it would be a pre-existing condition.
That's right.
And so
it was a pretty glaring injustice, and I think that's why it was addressed in the Affordable Care Act.
Right. Now the question is how well that's going to stand up. I mean, it did survive a Supreme Court challenge at the Supreme Court.
It did, and I was surprised about that. And a number of us had mixed feelings about it.
Yeah.
I mean, on the one hand, well, okay, so now we do have, you can call it that, a national health plan, but it falls short.
Yeah. So let's be specific about how it falls short. Well, it's, I mean, we've been talking about Obamacare, but Obamacare is really Romney Care, and which was the plan that was put forth in Massachusetts. And that was essentially written by the insurance companies. So it sort of leaves the insurance companies in place.
That's right.
Leaves them fairly loosely regulated. There's some things they're not supposed to do, but who's going to stop them from doing it?
Right.
So, were there really any significant changes besides the mandate that if you don't buy insurance, they're going to punish you?
Yeah, what the mandate does is it just requires us all to purchase a flawed corporate product.
Yeah. So in other words, you have to buy something from these people who are gouging you, and you don't have a choice. You got to do it. So, yeah, there's a lot of people who object on that level, but the other thing is, will it rein in the prices? I mean, I've been sort of charting it for the last few years because in 2000 was it 4? It was 15.4%, and in 2007 it was 17.9, and then last year it was 18.6, and now it's projected to be 19. It's just growing,
Well, if we have one unified risk pool, it might, but to me it remains to be seen.
Yeah. So, one unified risk pool. What does that mean?
That means everybody in and nobody out. When you have, I need some help explaining this too.
Yeah.
I'm losing it.
So it's so you've got single. Okay, so you're looking essentially at single payer, or you could be looking. I mean, in the Bismarck plan, you can have separate risk pools because there's a lot of separate companies. But in a national health care or a single payer system, you only have one pool. Everybody is included. So all the money goes into one place and then it's dispersed. So, if you're young and you're healthy, you're probably not going to need it, but you could get hit by a car and that would be a serious problem. Or, you might wind up with cancer or something like that. So people who are healthy are paying into the system. covering the cost of people who are not healthy at that time. And then when they get, when somebody gets fixed, goes back out and starts working, then they, pay into the system again. So everyone's paying in, people are getting their needs met, and it's a single pool. It's not, you don't get dumped in with the bad, In other words, if you've got a certain condition, you don't get dumped in with a lot of other people who are very expensive. And that's the game that was being played as high-risk pools. But another thing in the United States that would happen is just the whole inequity. Let's say that a company has a health plan, and the CEO needs a heart transplant, and some worker on the line needs a heart transplant. Who's going to get the heart transplant?
Well, you would think if dollars talk that the CEO would get it.
Yeah, in America that's basically what it would be, because they are decision maker as to whether to stay paying that premium to the company. So you have to keep the decision makers happy, but the people on the line, you can find a way to deny that. So do you think that kind of stuff went on in America?
I'm sorry?
You think that kind of discrimination about who actually gets the services goes on in America?
I do.
Yeah, so you agree with me. Yeah. There's lots of examples. So let's talk about sicko.
Okay.
Michael Moore. Michael Moore challenged this, and I remember the first time I saw the thing. I was part of a group down in Southern California that was working on healthcare stuff, and there were some advanced copies of it floating around, and we wound up with one of them, and so we had a bunch of people, around to sit down and watch it. All the whole group got together and we watched it, and it was kind of interesting because it's such a horrible subject, but at the same time he laughed all the way through it. I mean, it's like funny.
Yeah.
He can make something humorous out of, really serious set of problems, and talk about the inequities and who's getting excluded and why they get excluded and who's making money, and who's lying and who isn't, and all the rest of it.
I actually got to see it in school, but it's been a couple of years, and the most memorable part for me was him in a boat with a handful of people who need health care rowing down to Cuba.
Yeah.
And because they had heard that they have universal health care at Guantanamo Bay, and on his megaphone. That was good.
And so then they wound up getting these people. Actually, the people were all 9/11 first responders who had been sort of ditched after they came in and they cleaned dead bodies out of the rubble and all the rest of it. But then when it came to their health care, when they were either injured on the site or a lot of respiratory problems coming out of that, they were denied service.
Right.
And so it was people there who had been first responders who were sort of not being taken care of. So, an interesting film, but still relevant today because nothing's really changed.
Yeah, that's true. Well, I mean, the costs are higher.
Costs are higher.
Prices are higher. Yeah.
Prices are going up about 0.5% a year of GNP. It just gets more and more expensive. And so, how high do you think it's going to go before the system collapses?
I don't know what it would take. I can't see the future, but I do know that that the rate premiums are increasing.
Yeah.
It's going to match the income of a family of 4, I think, by 2025.
Median household income.
Yes.
In other words, it's growing fast enough that it will exceed median household income.
So by 2025, whatever you make, if you were going to be covered, that's what you would need to spend on health care.
So, can America survive on that system?
It doesn't seem like it, unless nobody's going to get health care, and our fatalities and our outcomes are just going to get worse and worse.
Yeah. But if we've got climate change coming along and it's going to reduce the number of people who can be here, isn't this a convenient way to start eliminating the population?
Well, that's an interesting idea. I'm not sure I can share on that line.
Yeah.
I've got to stay optimistic. I don't know. Reduce the population of people who can live here. So, I mean, we'll still need health care.
Let the marketplace decide it. If you can't pay, you deserve to die.
Right. Well,
die in the streets.
And I mean, we've seen what happens under that system, and that is what happens.
Yeah. Yeah. So we're looking at it getting to the point where people are dropping off the bottom. And so the question comes down to, if we talk about, say, a single payer in the system in the United States, the first thing you get out of a lot of right-wingers is it's just tax and spend, and it's more extra taxes. But if we went to a single payer system, would we be paying more than we're paying now, or would we be paying less?
As a nation overall, we'd be paying much less. Some people would be paying more, but under an equitable system, there would be some people who wouldn't be able to afford to pay anything, and they would pay nothing. And so, you know, it would be a progressive tax system.
So, yeah, there's been a plan that played in California for a long time, or it keeps coming up. And what was happening when Schwarzenegger was governor is it would pass both the state assembly and the state senate, and then Schwarzenegger would veto it. And then this past year, Schwarzenegger wasn't governor anymore. He was term limited out. And so Jerry Brown becomes the governor. And so once again, it didn't pass, but this time it failed in the Senate. And so what happened was it cost the insurance industry, or insurance, big medical groups and big pharma, paid $1.4 million to buy 6 Democratic senators who just didn't bother to show up. And so that vote failed because 6 people decided not to show up. They got paid $1.4 million. So the cost, so the question is, in California, how much profit is being made in a year from health care that was protected by that? And the answer is about a little more than $50 billion a year of profit is made in California. So for $1.4 million, you can keep that $50 billion a year coming in.
Yeah.
Pretty frightful.
It's a decision that I would make. Yeah.
So pretty
seems like a good return on your investment. Is there a percentage attached to that?
Yeah, I think it's like, what, 2.7 million % or something like that?
2.7 million %.
Return on investment. I mean, what better investment could you possibly make?
Should package that and sell that.
Yeah, really. So, yeah, because California's got a gross domestic product of about $2 trillion a year. And healthcare being 19% of that at this point. You do the numbers, and then the actual profitability is quite high. Most companies are making between 10 and 20% off their cash flow in terms of profitability. So it's quite good. So if you average with 15, it comes out to about $50 billion of profit.
Well, Vermont went through a similar process, but they were successful in establishing Green Mountain Healthcare for their state, which is a universal single-payer system. And a lot of people in our movement got energized when they, a couple of ladies from the Vermont Workers Center, which was key organizing behind that movement, came out to speak. And one of the lessons that they shared with us is that a people's movement can redefine political priorities, and there's a lot of money, and we're not ever going to be able to match those kinds of dollars as far as the legislative process is concerned. We simply can't buy politicians the same way, but we can unify our voice, and we can demand with our votes that these changes occur.
So that was actually the thing that inspired them was Bernie Sanders.
I remember hearing you talk about Bernie Sanders.
Bernie Sanders is an interesting character. I've met him several times. My mother lived in Vermont, and so several times I wound up, when I was visiting with her, he would show up at a mall or a city center or a restaurant and just come through and introduce himself and shake hands. I mean, he went door to door, essentially for, he wound up as the mayor of Burlington. And that was
the biggest city in Vermont.
Yep, and he was. This is a nice Jewish boy, leftist radical from New York City, who I think it was a 6 or 8-way race or something like that, and he got the plurality in it. And so it wasn't by much, but he became the mayor of Burlington, and people warmed up to him and really liked him. He was considered to be a very effective mayor, and did a lot of constituent service. And very responsive, and then ran for office and lost, and then ran for office again, and lost. This is for federal, for U.S. representative, and then finally won. And so I guess he spent 5 years knocking on doors to get his seat in Congress. and now he's a senator.
And that right there highlights a major difference between Oregon and Vermont. That
You
it's an
could-
inspiring example, but
You could do retail politics in Oregon because the population density is about the same. Vermont's a smaller state. We have more people, but you know, you still could do retail politics and just, you know, knock on doors and go visit people and ask, you know, talk to them and do all that stuff. And so because he did that, the people who ran the campaign modeled it after his work. A lot of, you know, house parties, a lot of,
Yep.
you know, door to door, a lot of, you know, just town meetings and the whole rest of the thing, and just working the population, talking to people to get them to realize that they weren't, you know, the system was not working for them.
right.
And so their rallying cry, if I remember right, was healthcare is a human right.
Yes, healthcare is a human right, and that is becoming a rallying cry here in Oregon. And gathering people's stories, that was a key organizing tool that they used. And you know, it's a great way to open conversations, and you just to a room of people say, who has a healthcare story? You know,
Yeah.
before you even start in sharing your message, invite people to come forward. And the president of our coalition is Michael Huntington, and he's a member of PNHP, and he's one of the Mattis Health doctors. And he got a pretty compelling story on a trip that he took to Lincoln City to gather stories, you know, and to share the message of healthcare as a human right. And there was a woman in Lincoln City, and her name is Kelly Howard. She's 30 years old, and she's a single mom, and she's a glass blower. And she's existing on a private healthcare policy for catastrophic coverage. It costs her $400 a month, and there's a $16,000 deductible. And so, you know, it offers her no practical health care. There's no preventive. There's, you know, there's nothing that would enable her to stay healthy. I think the way Mike Huntington phrased it was it served as a sort of ransom on her home.
Yep.
And she also shared the story of her boyfriend who had a compound fracture in his ankle, and so he refused a $5,000 ambulance ride and just drove to Corvallis by car. Got somebody to give him a ride. And he had the fracture reduced and had an inflatable splint with vacuum drainage applied to it. Just the best care that they could provide, you know, something that was going to heal it up nicely. And then at the hospital, they realized that his insurance did not cover that device, and so they painfully removed it from his ankle and gave him another one, and it wasn't working. And they told him to go home and just do the best that he could with it. And you know, a story like that really gets to me for two sides. I mean, the suffering, you know, the unnecessary suffering, the fact that they, you know, that they did their best healing and then undid it, but also from the perspective of doctors, as we were talking about earlier, doctors being really disgruntled with the system, because I can't imagine being in that position. And you know, you say first do no harm, but what if the healing that I just did wasn't covered by your policy?
Yeah.
You know, I can't imagine being in that situation. I would have a hard time following through with that.
Yeah. And I'm sure a lot of doctors do have a hard time with that. But yeah, it's a system that's broken. And you know, you can go into a room and, like you say, just ask who's had a problem with health care.
Right.
The hands will just go right up. And just about everybody you talk to's got a horror story. So
Yeah.
So if the system's not working, how come it isn't getting fixed? Because the reality is, if you ask people, you know, who's in favor of single payer or who wants to have health care reform or whatever, you always get a strong majority. So why is it that people aren't responding to that?
Well, I think a lot of people believe that it's not possible because that's what they're being told, you know, and certainly by politicians as well.
Yeah.
You know, and that was something that they ran up against in Vermont. They were being told, "Oh, that's not possible." Sure, I'm for a single payer system, but it's just not politically possible. I'm not going to take it on as a priority. And then what they realized was that those politicians were hearing more from their opponents and more from the status quo than they were hearing from them. You know, and that was a part of their success once they learned that lesson, that a people's movement can redefine political priorities.
But what you have to start doing is bringing a lot more people to the politicians to say, excuse me,
It's true.
we're watching you, and this is how we feel, You know, we know that you're getting campaign contributions. We know that you're getting visited by lobbyists. We know this, and so you have to keep a lot of pressure on it. It's not just the occasional once every 6-month visit. It's got to be this steady stream of people just showing up and saying, we're watching you. And that's a different thing for people. The United States has been depoliticized to an enormous degree. I mean, we look at the city council race going on right now. There's only one election in the city council that's being contested, and it's Betty Taylor and Juan Carlos Valle. It's the only one. Kitty Piercy doesn't have an opponent in November. George Brown doesn't have an opponent. Chris Pryor doesn't have an opponent. Andrea Ortiz does not have an opponent. That's amazing.
Yeah.
That's a staggering failure of our political system.
Yeah.
You know.
Well, and I mean, what do you think it is? You think it's apathy?
I think that the country has been actively depoliticized since the late '60s. I think it comes down to the Powell letter. Because if you look at the '60s, what happened during the '60s, and that was when my parents' generation reached middle age. Okay, they were, you know, in Tom Brokaw's words, America's greatest generation, the young men and women who ended fascism on 2 continents during World War II. Well, they hit middle age and they started looking around. And what did they see? They saw rivers that burned. Okay, I grew up in Connecticut, and the Naugatuck River actually had a little pool. It was so polluted that it would sustain a flame. Okay, rivers that burn. Okay. I can remember watching on television and seeing all the civil rights stuff, you know, dogs being, you know, dogs and fire hoses and beatings and people getting shot and all the rest of this stuff with the civil rights. In other words, people being beaten in the streets. For what? So they can vote, okay? Something that we fought a civil war, you know, for 100 years earlier. And there actually, when I was growing up, were still a few veterans from the Civil War who were still alive. You know, it's kind of these, you know, 120-year-old guys, and just, you know, there's still a couple of them around. But the thing is that they saw that, and then the third thing was they saw, you know, body bags coming back, you know, middle-class kids coming back in body bags from Vietnam and other foreign adventures. And the thing is that was not acceptable. If it had been working-class kids or blacks or something, nobody would have cared. But it was middle-class kids. It was people who aspired to a better life, you know, who were doing okay, you know, in the expansion at that time. You know, where you could have a single wage earner providing for a house. I mean, my father worked, my mother didn't, and we survived, and we owned a house, and, you know, took vacations occasionally and did all that stuff. And it was tight, but, you know, you could do it then. You can't do it today. And so what happened was when they started looking around, they realized, whoa, America's, you know, we have all this American exceptionalism. Maybe America isn't really delivering on the dream. It isn't delivering on the promise. And so they elected the most progressive Congress that's ever existed. And, you know, they passed all kinds of legislation. I mean, you look at people like Fred Harris and Birch Bayh and George McGovern, and even moderate Republicans who were, you know, really quite progressive. Olympia Snowe from Maine. But they passed all this legislation. The Clean Air Act, the Clean Water Act, the Endangered Species Act. Then, you know, when the Clean Air and Clean Water Act weren't enough to get corporate America to stop polluting, they passed the Toxic Substance Control Act, TSCA. And that was that corporations had to account for the toxic waste because they were still dumping it even after they were told not to. And so we had all of that stuff get passed. But that represented a change. In other words, every time a piece of legislation like that got passed, corporate profits got lower because you couldn't dump as much toxic waste, you couldn't abuse your employees, you couldn't this or that. And so there was the reaction to it. And there's been 40 years of consistent drumbeat, you know, the corporate message that came out as a result of the Powell letter. And that changed America, changed it completely. So it's a different country than it was 40 years ago.
Right.
And so here we are, all these problems that, you know, it was kind of like Ronald Reagan's tagline for his campaign was, "It's morning in America." And so what we basically did was we rolled over and went back to sleep for a generation. And now here we are, you know.
It's daunting. It doesn't look good. It kind of makes you want to roll back over and go back to sleep. But it's going to take a movement for real democracy to overcome something like that.
Yep.
We can't fight them on their own turf, and they can't fight us on ours either.
No, and our turf is we're going to have to talk to people. We're going to have to face-to-face, one-on-one, knock on doors, and make the change happen. Because if we spend our time in talking amongst ourselves in closed rooms, nothing's going to change.
That's true.
It's, you know, the question that I kept asking for years and years, is it bad enough yet?
That's what I was just going to say. There's an extremely pessimistic notion, which is it's just not bad enough yet.
Yep. And so, you know, on that level, a lot of people are saying, well, maybe it'd be a good thing if Romney got elected, because then it'll get bad real fast.
I remember hearing that when George W. Bush was elected and then re-elected. Some people
Actually, he wasn't elected either time.
It
was stolen outright.
Thank you for bringing that back up. Yeah. So when he became president, the first and then again the second time, I do remember that reaction. There were some people probably just trying to find something to be happy about, saying, good, because it's not bad enough yet. And apparently it's still not bad enough yet.
No, and people are actively involved. You know, during 2000, it kind of came as a surprise. I mean, there was like all this covert voter suppression that went on. And, you know, then electronic voting machines, paperless electronic voting machines know that, you know, we're reporting these really bizarre numbers. I mean, for the first time in American history, exit polls did not match the voter numbers. For every election prior to that, exit polls matched. But then in 2000, we had this constant drumbeat about polls are unreliable, they're unreliable, they're unreliable, they're unreliable. Well, they had been reliable all along for, you know, long periods of time.
They're just not reliable anymore, was the message.
That's
You can't count on those anymore.
No, can't do that.
Those are out.
And so, you know, a lot of people studied that kind of stuff, and there was a systematic bias, you know, between the actual results and the polls. And they found that there was no bias in those districts where there were paper ballots. But in the districts where there was paperless electronic voting machines, there was something like a 11% national bias in favor of George Bush. Okay? In other words, if there was a paper trail, no problem. But if there's no paper trail, George Bush wins.
Every time.
Every time, by 11%.
That's scary.
It's very scary. But of course, who reads those kinds of reports besides a few nutcakes like me? You know?
Nutcakes.
And,
one of the 10.
Yeah, something like that. But yeah, that's what went on. There were actually a lot of little documentaries that got put out, you know, along that, about that kind of stuff, and it just never really got traction.
Yeah, I remember hearing the outrage, and then it just kind of drops off.
Piffed, you know. But the thing is that it's that kind of stuff that keeps the power elites in power and allows them to run a system where, you know, like the healthcare system that we have, or the health insurance system. It's not a healthcare system because we're not providing care.
That's right.
We're providing profit.
It's a health insurance system. That's right.
Exactly. We're providing profit for those select people who the system says, yeah, we're going to take care of you, the rest of you, we will take your money, and then just refuse service.
Well, fortunately, it is starting to come into public eye where people are realizing that something needs to be done. There are some misguided efforts.
The question is, you know, at a certain level, the question is it too late? I mean, recently there were a couple of studies that came out. One is tracking the amount of wealth that's been removed from the country. And worldwide, they figure that there's somewhere between 21 and 32 trillion dollars of wealth that's been moved into offshore tax havens. So, you know, this is what Mitt Romney's been doing. But that represents almost 10% of the value of all assets on the planet together, you know, which is a staggering amount of money.
That's a lot of money.
Yeah, the rich have just pulled it out of the economy, and they're sitting on top of it and protecting it from protecting it. Yeah. So we've got those kinds of systems. Now the question is, will the society, I mean, what's the future going to look like? Is it going to be rosy, or
The picture you're painting is bleak.
is pretty bleak when you come right down to it?
It just made me think, like, it's just less obvious. Like, under the feudal system, you knew who the king was.
Yeah.
And now we don't really know what's going on.
Yeah, we've lost that information. So.
It's a secret.
Yep. Who's secret government by secret people who are unaccountable and unelected. And yeah, a lot of that kind of stuff going on, which is unfortunate. But back to healthcare. So we have a group meeting in Eugene. I guess they meet at eWeb the first Wednesday
It's
of every
the first
month.
Wednesday of every month. It's at 7 p.m. and that's our monthly meeting. And so anybody who wants to get involved should definitely. That's a great first step, is to come to these meetings. In a lot of ways, our larger organization and our local organization are still getting organized and getting these rallying cries. We've learned some lessons from Vermont that we're taking and we're moving forward with.
But I guess there's some discussion of actually putting it on the ballot for 2014.
That's right.
A healthcare, a single payer plan for 2000 on the ballot.
Yeah, it's the son of 3510, which has failed, and so that's Representative Dembrow who's going to do that. And so we have a legislation and policy committee that is going to begin meeting with him and try to get our voices heard, so that it's something once again that works for people.
So that's to get it on the ballot. We got to do some signatures. So how many signatures? Do you know?
I don't know.
I think that somebody said something around 100,000 to get it on, but I'm not sure how much.
Well,
that is.
we have 53 member organizations,
Okay.
and I've also heard it say that if we can count on these member organizations, which we've been able to count on them so far for contributions, if we can count on them for volunteer, that 100,000 signatures is not going to be a problem.
No, it should not be. But the issue is, again, a campaign, and you want to win this thing. So that's a lot of people, starting to talk to their neighbors, which is, we talked a little bit before about America being depoliticized, and that was the main core of the Powell letter, was just co-opting, everything on the left. The Reagan administration was brilliant at that, but just shutting down, and people, for 30 years, people have sort of not been out there communicating in a political way, which results in a Eugene City Council election that only has one contested election. And that's sad. But we've got to start to reverse that, because if we don't, we're in trouble. We've
got our work cut out for us, but a human rights platform is something that I think that everybody can embrace.
Healthcare is a human right. So how do you talk to conservatives, people who argue, well, if they don't have a job, and they're not making money, they deserve to die in the streets. If you can't afford it, get an education, get a job, just do the American dream and stop whining.
Well,
what do you say to people like
my
that?
go-to responses tend to center around those. Like those business arguments, and just the fact that it's cheaper. Like, it would be the right thing to do even if it was more expensive, and that's how I feel, but that's not how they feel. And so then you can go into these financial arguments, and you can start talking about how much we spend on healthcare, and that we don't need to.
So in other words, you can say to them, so you're telling me that you're in favor of paying twice as much as anybody else to get not as good outcome.
Right.
Okay.
A lot like that.
So yeah, that sounds like an American value to me. Spending twice as much for something that's not as good. Okay, so you're defending that. I mean,
well, that's the way that it stands.
So you get to say that to them, and they'll get mad at you. But I don't know. But the other question is, well, do you know somebody who's had problems with their health and health insurance?
Right.
And the answer is, most of them do.
That's why I think that's such a great intro. Before you give people a chance to like you or dislike you, or your message, you start talking about the problems with healthcare, and people want to share their stories, especially if they don't really realize where you're going with it. You say, is our healthcare system working for you? And once they start to get into it, and you can respond with how it can be better.
So is it working for you? Is it working for your family? Is it working for your friends?
Right.
Oh, you got some friends that are having a problem with the system, huh?
Get them to think about their personal experience and their own suffering and that of their neighbors before they start to go back to their conservative values that would cause them to reject an improvement.
So, yeah, it's going to be an interesting conversation, but if the group does decide to put it on the ballot, certainly it'll go on by 2016. Which seems a long way off.
It does seem a long way off, and 2014 is really exciting because some of the waivers that are available from the Affordable Care Act are going to be available in 2017, and so that puts us right on target for that. So.
And the one problem with 2014 is that it's a midterm election, so you're going to get lower voter turnout, and lower voter turnout's going to actually help the conservative cause because Republicans do go vote. And so if the people who are supporting this change stay home, then they're going to win. So it's got to be at least 5 or 6 points in the election would be accounted for by the fact that it's a midterm election, which makes it tough, but the thing is that it's an organizing tool. Now the question is, do you think the group's actually going to get it together to do the organizing?
The optimistic answer, yes.
Yeah, okay.
There's a lot to be excited about, and there's a lot of really great people that have gotten involved, and I do have a lot of confidence in it.
Yeah. So, it's I guess it's all the same stuff with a standard political campaign. Got to round up the people, get them some talking points, and put them out there.
Yeah.
So you notice that we have 2 minutes left.
That's right.
So any closing thoughts on all of this?
Well, sure. I'd like to share the human rights principles that we learned from Vermont.
Okay.
And they are universality, equity, accountability, transparency, and participation. And so what this is a framework and tools that we can use to analyze whatever healthcare plan is presented to us, like whatever it is Representative Dembro is working on.
So is the
Let's go through
plan that we currently have is clearly not universal.
That's right.
And so
universal. If you're a human being, you get care. It's non-exclusive of immigration status, and it's non-exclusive of women's reproductive rights. It's a universal plan, and that's exactly what it means. Or how much money you've got. That's right. Well, and that brings us to equity. Yeah. Equity is that it's non-discriminatory from your health conditions, your wealth.
But that sounds like something out of the Declaration of Independence. We hold these truths self-evident that all men are created equal and endowed by their Creator.
We do say that health care is a human right for a reason.
That would even probably extend to women.
Yes.
Okay.
And the poor. And immigrants. Accountability. I'll just read from this one. The healthcare system must be accountable to the people it serves. It must ensure effective delivery of care and stewardship of resources that improve individual and population health and provide means to uphold and enforce human rights standards in care. And so what I'm reading from right now is actually the strategic plan from the coalition. Transparency, that's pretty obvious.
Yeah. So our system's not very transparent. So it's hard to, it takes a little effort to figure out who's making the money and who's not getting the service.
Well, the consumers don't even know what it costs.
Yeah.
It's a big part of the problem. And the participation is that this plan must be created by the people that it serves.
And on that note, we have run out of time. So I want to thank you for joining us, and we will have to do some more of this because this issue is going to be around for a bit, and we need to put some work into making a better system happen. So thanks for being with us, and we will see you next time.
That's right. Thank you.
So.
There's something happening here. What it is ain't exactly clear. There's a man with a gun over there.